While the fight against COVID-19 has captured much of the public's attention over the past 20 months, more Mainers are losing their battles with substance use disorder. According to the Attorney General's office, 504 Mainers died from an overdose last year, a more than 30% increase from the previous year. From January to August of this year, there have been nearly 6,000 overdoses. 399 were fatal. The demand for treatment has put a tremendous strain on nonprofit detox centers that accept MaineCare, the state's version of Medicaid, and people who are uninsured. But as New Center Maine's Vivian Lee shows us, those programs are finally getting a boost in funding that's long overdue.
While many aspects of our society are emerging from the COVID-19 pandemic, lingering isolation and stigma is still tightening its grip on people battling substance use disorder.
There's also just this extended desperation, right, of COVID, and so I think a lot of people hit their limit.
Oliver Bradeen is the executive director of Milestone Recovery in Portland. During the pandemic, the center's clinical staff has seen more patients who are using dangerous drugs, including fentanyl.
Fentanyl, or those could be like a benzodiazepine, like a Xanax. So there's a lot of street drugs going around right now that people aren't exactly sure what they're using, which increases the risk.
Milestone is one of only 2 detox centers in the state that accepts MaineCare, which provides financial assistance to people with limited income and uninsured patients. The program, which has 10 beds and its 7-day treatment program, is always at capacity. For many, the lack of access to treatment is fueling the growing number of fatal overdoses.
People are dying because of the lack of resources, and the shame, guilt, and remorse.
Joe Robichaud was using and selling drugs by the time he was 16. After serving time behind bars, he ended up at Milestone 4.5 years ago, his last hope. Now in active recovery, he's a peer navigator at the detox center, mentoring others on their journey to sobriety.
I think it's very important to know that somebody else has gone through what they've gone through in that pain.
Earlier this fall, the Mills administration increased the reimbursement rate for MaineCare by 77% for detox providers, including Milestone and the New Horizons Detox Center, a 10-bed facility in Hamden. Now, low reimbursement rates for MaineCare made it difficult for nonprofit detox centers to compete with hospitals and other medical providers for nurses and nursing staff. Now they say they can offer competitive wages. Suzanne Farley is the executive director of Wellspring, which operates the New Horizons Center. She tells News Center the program is currently closed, but a decision on reopening the detox center is expected later this week. Our intent, she says, moving forward is to invest in our employees' wages and to hire for long unfulfilled vacant positions, all in an effort to provide an important safety net of resources and hope.
We can recover.
To people in the throes of addiction. In Portland, Vivian Lee, News Center, Maine.
And for more information on recovery services and treatment, including Milestone and New Horizons, you can go to our website and the News Center Maine app. The data from the Attorney General's office shows that drug overdose deaths have dramatically increased during the pandemic. In 2013, quarterly death totals were at or below 50 for the entire year. Those numbers peaked in late 2017 before declining for the next 2 years. Then in 2020, they jumped back to their highest levels with more than 260 overdose-related deaths in the first half of last year. And the first quarter of 2021 totaled the highest death rate of any 3-month span since records have been kept, with deaths at 155. It's believed the pandemic has created instability in the drug supply system and has also led some people to increase their drug use amid all of the uncertainty.